When we talk about renal calculi, also known as kidney stones, there are two major things that we have to keep in mind while giving treatment to any such patient. The first and the foremost, definitely, is removal of the stones. But the second and the more important one is preventing the recurrence of the stones and also keeping a check that while removal of the stones, no damage is done to the kidneys. Now, the first part, that is removal of stones. There can be multiple type of kidney stones. They can be from calcium oxalate, they can be from uric acid, like uric acid stones, and there can be other stones. But what is important over here is that any kind of stone, when we have to give any medication for that stone, we are to add medicines which are mentioned as Lekhan Karam medicines in Ayurveda. By Lekhan, we means scraping action. Because when we are to remove a stone, if we start giving the patient diuretics without those scraping action medications, the stone might obstruct the ureters and might cause even more damages. So before we start pushing that stone out to the urinary tract, we firstly need to give scraping action medications to scrap that stone, to break that stone into smaller fragments, which can then be pushed out of ureters with the help of medications that cause diuresis. That's why when we are giving our combinations in renal stone, the major action, the first action of our medication is the scraping action. Because the medications which get absorbed and reach the peak plasma level immediately are the SHARs, those which can give scraping action. Another medication known as Sange Jahud, also mentioned as Ber Patthar and Hazral Jahud, is a medication that disintegrates any kind of renal calculi into smaller fragments. It's been added in sufficient quantity because we want the stone firstly to be broken into smaller fragments. And this action immediately starts once the medication is consumed. And after that, the medications which can then push the stone which is broken into smaller fragments out to the urinary tract, start their action because they are slowly and gradually absorbed and are a bit late to reach the peak plasma level. That is the first part of the treatment. Now the second part. We need to add certain alkalizer in the medication which can keep the urine alkaline, which is good for the kidneys. And nidus is basically a scar which is left over inside the kidney tissue even after the removal of the stone. There are medications like Punarnavako, Shura, Ayurveda, which along with the disintegration of stone also gradually repair any kind of damages that were done in the kidney. Varuna, again a herb which is used, is a very good herb to prevent the recurrence of stones inside the kidney. So as a result, if Ayurveda is taken in a proper way, in the scientific way as we have been using over here, it's not just the stone that gets removed out of the kidney, but also along with that, it's pretty safe for the kidneys and further stone formation is also prevented.